Hi, I'm Shayla Roberts, a lifestyle medicine coach. I want to help you put more life in your years by eating better, living better, and aging better. And today we're talking about what should we measure. When people want to be successful at change, it is easier to know where you are starting from, even if this is difficult. I can't tell you how many times I have spoken with people who haven't weighed themselves in years. Not that weight is the only or best measure of your health, but it is an easy one to measure. Often people will say, I don't want to know. Some of them, even when I weigh them, stand and face away from the scale and say, don't tell me. I will weigh myself when I lose weight. I hear that often. There is nothing about your weight that reflects on your value. Establishing a baseline, however, is an important first step. So you are not your weight, but no one changes when they are comfortable. And this is not about feeling bad. It is about owning the space you're in now and leaving denial behind, understanding that maybe this isn't a great place to be and you are ready to make a change. So there are a few things that you should measure, and you might be thinking, I know what to do, but I still can't seem to change. That is a topic of another video because deep down we all know what to do, but knowing doesn't change behavior. So look for my video on changing knowing to doing. That will be coming very soon. But today we're going to talk about what else you can measure. What should I measure when I'm starting? Because then you know if your changes are effective. So regardless of your current health and fitness, your body mass index and a waist circumference can also give you a baseline measure. I know the body mass index has some controversy around it, but because it doesn't tell you your body composition. However, it is a tool for establishing the risk of chronic health and conditions that are based on your height and weight. So somewhere between 19 and 25 BMI is considered healthy. And there's many online tools to easily calculate this, including ones that are in the notes in the bottom. It doesn't reflect your health, but it is a good start. And if your BMI is over 30, you are at risk for many chronic health conditions. Waist circumference is important because we know that abdominal obesity will affect our long-term health, and all you need is a tape measure, and you don't need anybody to help you. It's easy to do at home. There are also instructions here how to easily measure your waist circumference in the correct spot, and you can also calculate your waist to hip ratio, and that is also in the show notes. Women should have a waist to hip ratio of 0.8, and men should have or less, and men should have a waist to hip ratio of 1 or less. So what kind of fitness tests, if you're starting to change, what kind of fitness tests are important to measure? Baseline fitness tests are important first step for measuring improvement over time, because it is really easy to think after a few weeks of consistent exercise that nothing much has changed. But I promise you it has. We get the biggest benefits from doing nothing to doing something. From working with many extremely deconditioned adults, those coming back from injury, illness, surgery, fitness improvements happen really quickly. You would be surprised at how quick they happen. They're also easy to minimize. These improvements are easy to ignore, mostly because we often forget that a flight of stairs was difficult, or that we couldn't lift something previously that we can easily lift now. We don't think about things getting easier. We notice when we can't do something, not when it is effortless or when we can't do it. So you want to do fitness tests that include cardiovascular fitness tests, strength and flexibility, And there is a link to my 7-day fitness challenge in the notes where you can get 7 different ways to measure your fitness, including aerobic tests, strength, and flexibility. And those are really good to measure. And you can do them at home. You don't need any fancy equipment. The other thing I hear way too often when people want to change but maybe aren't quite ready to take that step is, I've got lots of time. I'm young, or I feel fine now, but I'm sorry. The sooner you start, the better it is. A study from 2020 reinforced the importance of fitness for long-term health gains. In fact, they followed 110,000 men and women who were ranked for 5 health factors, and those with the highest score had longer and healthier lives. So they followed these 110,000 people. They ranked the 5 health factors to find out how many extra disease-free years they lived compared to people who didn't practice these healthy habits. So I'm going to tell you what the healthy habits are and what the results are. So the healthy habits that were tracked for healthy lifestyle were being a non-smoker, having a healthy body mass index or BMI of between 18.5 to 24.9, doing 30 minutes of moderate to vigorous aerobic exercise a day, low alcohol intake, and having a healthy diet score in the top 40% of people in the study. So people were assigned a healthy lifestyle score ranging from 0 if they had none of these healthy habits to 5 if they followed all the healthy habits. And the people with the highest scores had the longest disease-free years. So what exactly did they find? They found that for people aged 50, women with 4 or 5 healthy lifestyle habits can expect to live another 41 years, and 34 of those will be free of disease. Women aged 50 with no healthy lifestyle habits can expect to live another 31 years, and 23 would be disease-free. Men with 4 or 5 healthy lifestyle habits can expect to live another 39 years, and 31 would be disease-free. And men with no healthy lifestyle habits can expect to live another 31 years, and 23 of which would be free of disease. So practicing these 5 healthy habits is really, really important. And you can see the study in the show notes. Healthy habits add up to 10 disease-free years to your life. Men who smoked heavily and obese women, so had a BMI over 30, had the worst disease-free expectancy rates. So 90% of people with unhealthy lifestyles have been diagnosed with diabetes. 50% of those with cancers were estimated to be due to unhealthy lifestyle factors. And we know that even if you do have diabetes or cancer, practicing these healthy habits improves your outcomes and makes life a lot easier. So disease-free years, that is what we want. That's what everybody wants. We want to be able to do the things that we love to do. We want to enjoy life. We want more of our years spent being independent and engaged in activities, enjoying all the things and people that we love. So practicing healthy habits makes a difference. And if you want to change, it does take a little bit of consistent practice to reap the rewards, but measuring where you started from is really motivating. I know it can be very hard at the beginning because it's hard to change, and it's hard to change alone. So if you're interested in getting the tools you need to have a healthy lifestyle, stay tuned for more reasons to practice good health habits. If you're practicing good health habits now, congratulations. Don't quit. And you can still measure your body composition and your fitness to make sure that you're maintaining it. But think of your healthy habits as your personal health retirement plan. It is one of the best investments you can make in your health, and you can change your future.